All right, so today we're going to be going through the chin pivot technique, which is an HVLA technique for the upper thoracic vertebrae, T1 through T3. You're going to be using this technique for any flexed type 2 lesion. So on our patient, we have a T2 flexed, rotated, and side bent right. And so what we're going to do is we're going to be using the chin pivot technique to correct that. So what you're going to do is you're going to start with the diagnosis. And then you're going to side bend the head into the barrier. So that means we're going to side bend her head to the left. So monitoring the segment, I'm going to side bend her to the left, leaving her chin on the table until I feel like I've reached my barrier at the right posterior transverse process. Then with my hypothenar eminence, I'm going to place that on the transverse process of T2 that I'm trying to correct, and I'm going to apply an anterior, lateral, and slightly caudal compression down into the barrier of that segment. Then to further lock out the barrier, I'm actually going to rotate the head to the right, and what that does is that I'm actually rotating all the segments above to the right to relatively rotate T2, what I'm trying to treat, to the left into its barrier. And as I do that, I notice that I am going to rotate the head until I feel that I am right at the barrier underneath my hypothenar eminence. With the thrust, no thrust occurs with the hand that's on the head. I'm just maintaining pressure and stabilization in the head to maintain my barrier. My thrust is going to be through a straight arm down into my hypothenar eminence onto the segment that I'm trying to treat. And it's going to be an anterior with a slightly lateral and caudal force as I do so. So I'm going to wind up into the barrier. I'm going to have the patient take a big breath in. She's going to blow it out. I'm going to take out the slack. And then once I feel like I'm at the optimal barrier, I'm going to thrust down into the table and then bring her back to neutral and then reassess the segment.